Good afternoon again, and well, although you may not have been able to hear me, I'm excited to be able to share some aspects of human and animal diseases and provide some updates from the Minnesota Department of Health Zoonotic Diseases Unit. So as our name would imply, we specifically focus on zoonotic diseases, which are diseases that are shared between animals and people. And these can go in both directions. It's estimated that 75% of emerging diseases are zoonotic. They can be transmitted in many different ways through direct or indirect contact with an animal that's infected, or through a vector like a tick. And so they can be difficult to address because they cross-cut many different areas. And to address these complex issues, the Zoonotic Diseases Unit of the Minnesota Department of Health works with many different partners, including the Board of Animal Health, which oversees animal diseases, the Department of Natural Resources, which oversees wildlife health, the Department of Agriculture, as well as many others. And these partnerships are critical when we respond to crises situations involving zoonotic public health hazards, such as the current H5N1 outbreak. And so we have three core elements of our work that I'd like to highlight. And those include surveillance, outbreak investigations, and education and outreach. And for each core element, I'll use one of the diseases that we investigate as an example to highlight our work. And so first, surveillance. So routine surveillance is the systematic data collection used to prevent and control diseases, both in animals and people. We conduct different levels of surveillance for each disease, but the process generally looks the same. First, a case, whether this is a human case of a zoonotic illness, or in some situations an animal case of human or of zoonotic, potentially zoonotic illness, is reported to us. We then follow up to get more information, including reviewing medical or veterinary records to get more detailed clinical information. We may also interview the human cases or the animal owners to fill in any gaps in information and to assess where people could have been exposed or activities that put them at risk. These data are compiled and analyzed, and then throughout the year, we monitor for clusters of disease or outbreaks that may require intervention. And finally, we disseminate information, which we do through annual reports or putting data on our websites or doing presentations such as these. And so here are some of the diseases that we most commonly conduct surveillance on. You can see there's a wide range of diseases, from pretty common to very rare. And so out of all of these diseases, one of our main focus is rabies. Our team staffs the rabies phone, which is a hotline that the public can call during business hours, and healthcare providers, veterinarians, and police officers can call 24/7. We take over 2,500 calls through this line every year. We can help the caller determine the next steps that occur after an animal bite or an exposure to a positive animal, or any other kind of animal encounter where rabies may be a concern. Was this a worrisome exposure in the first place? Should we test the animal? Should we start the rabies shots for the person? We can talk through all those options. So we want to make sure that folks know that we're available, and we're happy to chat if you have any animal bite situations that you want to walk through. But while rabies assessments are common, I want to focus the surveillance talk on the bacteria Francisella tularensis, which causes tularemia, or rat bite fever. This bacteria is actually a tier 1 select agent, meaning that it has been researched as a potential bioweapon in the past. And the Soviet Union and the US actually had stockpiled it as a bioweapon in the 1950s and 60s. And one of the reasons for this is that it is one of the most pathogenic bacteria known. So being exposed to only 10 organisms can cause disease in humans. And so the Francisella tularensis does occur naturally in the environment as well. And so we see the surveillance that we do deals with naturally occurring cases. And it can survive in water and soil and decaying animal carcasses for an extended period of time. It's been isolated from mud as long as 14 weeks, tap water as long as 3 months, and dry straw for up to 6 months. And one study found live bacteria in rabbit meat stored for over 3 years. And so tularemia can be transmitted in many different ways. A person can get sick by ingesting contaminated water or meat from an infected animal. A person can inhale contaminated aerosols, which can happen during activities like mowing the lawn or high pressure spraying. The bacteria can also enter the skin through your mucous membranes, such as your eyes, nose, or mouth, or broken skin, like through contact with infected animals, such as field dressing a rabbit. Ticks are actually the most common mode of transmission in the United States, and the disease can be transmitted by several tick species as well as deer flies. And so occupational exposures can occur, particularly those people who work in outdoor occupations, veterinary occupations, wildlife biology, or also in laboratory settings. There's more than 200 different animal species, both wild and domestic, that can be infected with tularemia, and we've seen outbreaks in humans that have been associated with animals such as pheasants that have been infected. Also wild-caught raptors, quail, mink, fox have all tested positive for this disease. However, the primary wild animals that we see this disease in are rabbits and rodents. And ticks can maintain the bacteria in the populations, and cats are the primary domestic species that we see getting tularemia here in Minnesota. And so our role in this disease are to assess exposures to people when they're exposed to positive animals, or to assess their exposures if they develop any illness. This includes veterinary staff who may be treating positive animals, pet owners, laboratory staff who may be dealing with the bacteria. We monitor exposed people, and if they have concerning exposures, we facilitate antibiotic prophylaxis, and if they develop illness, we assist with testing and treatment for those who need it. And in certain situations, we may also offer site visits where we will go out to the place where people were likely exposed. So, for example, say there was someone who was mowing and mowed over a dead rabbit, and collect ticks from that site, or any animal carcasses that may be available. And so in 2024, we had a bit of a wild year for tularemia. Normally we see about 7 animal cases per year, but by mid-June, we had already seen 21 animal cases. And so we put out a press release warning the public about this increase in cases and what they could do to protect themselves. And so this graph actually shows the Minnesota tularemia cases since 2004. And the light blue bars indicate the animal cases, and the red bars indicate human cases. So in the past decade, we've seen an increase in animal cases reported, and in 2024, we ended up with 24 animals being reported. The vast majority of them were cats, but we did also have 6 dogs, which is unusual. They're not as susceptible as cats are. And we also had a record number of human cases, including 4 cases who had pneumonic tularemia, which caused a severe respiratory infection, and they were most likely exposed by mowing over dead rabbits or rodents. And so the prevention measures for tularemia, people, we highly encourage using insect repellent to prevent those tick bites. Also, don't handle sick or dead animals without gloves, and washing your hands afterwards. And avoid, if possible, mowing over animals either while you're landscaping or mowing. And then for our pets that are outdoors, if possible, keep your cats indoors. I know mine would not agree with that. And don't let pets hunt rodents or rabbits, and also use flea and tick prevention medication to prevent those tick bites. So then through our routine surveillance with all of our diseases, we may detect outbreaks. And so because our group oversees the surveillance of such a wide variety of pathogens, we invest in equally variety assortment of outbreaks. So each year there's an outbreak of salmonella linked to live poultry. We also usually have at least one enteric disease outbreak associated with petting zoos or fairs every year. We commonly also see enteric outbreaks linked to raw milk or raw milk products. We also get pulled into less routine outbreaks, like an outbreak of blastomycosis, which is actually an endemic fungal infection that affects both animals and people that was linked to exposure at a river, or a national outbreak of melioidosis, which is a rare bacteria that causes a disease that commonly occurs in Southeast Asia that was actually linked to imported aromatherapy spray. However, I wanted to focus on the work that we've been doing on H5N1. So H5N1 is still primarily an animal disease. However, these viruses, the avian influenza viruses, can be spread to people through direct contact with infected animals or their environment. Person-to-person spread is rare, and it's limited overall and has not been detected in the United States since this particular virus first appeared in 2022. This virus is currently a low risk to the general public, and rather is a risk, primarily an occupational risk to those people who have direct contact with infected animals or their environment. And so to date, there have been 70 people with confirmed H5N1 infections in the United States. Most of these infections have been mild, with conjunctivitis or an eye infection as the most commonly reported symptom. There have been 24 human cases that have been associated with known positive commercial poultry flocks. There have been 2 human cases who had exposure to positive backyard poultry flocks, including one person with underlying conditions who developed severe respiratory disease and passed away. This is the only death among human cases in the U.S. Thus far. And there have been 41 cases that have been associated with positive dairy cattle herds, the vast majority of those being in California. And 3 cases have actually been detected through routine seasonal human influenza surveillance, and their exposures are actually unknown. So here in Minnesota, we're unique in that we truly take a One Health approach to H5N1. 3 state agencies, the Minnesota Board of Animal Health, the Minnesota Department of Agriculture, and the Minnesota Department of Health, and numerous other partners are working closely together on this response. The response, because this is an animal disease, is led by our Board of Animal Health and Department of Agriculture partners, and we are a supportive agency where we are integrated into the animal response as human disease surveillance officers, and we enroll exposed people and responders into human disease monitoring and provide prevention recommendations and public health information to animal health partners, the animal industry, clinicians, veterinarians, and the public. And so for people who are exposed to infected animals, the PPE recommendations are extensive. Coveralls, boots, gloves, goggles, and N95 respirator should be worn in the farm environments. But as you all are well aware, these environments are often dusty, they can be wet and hot, and so compliance with these PPE recommendations is generally low. And so we monitor exposed individuals for 10 days after their last exposure to a positive animal. So we work directly with the farm managers or the owners who provide us with a list of exposed people, and then each person is contacted and given the option to enroll in health monitoring. If folks develop illness, testing and antiviral prophylaxis are offered as needed. And so to date, we have worked with folks from 186 poultry flocks, 9 dairy herds, 1 goat herd, and the owners and veterinary clinics associated with 5 positive cats. There have been over 2,400 exposures that have been reported to us, the vast majority of those being poultry exposures, but also dairy exposures and companion animal exposures as well. 83 people have been tested for H5N1, including 77 poultry workers, 2 dairy workers, and 4 people exposed to positive cats. And to date, there have been no human infections of H5N1 detected here in Minnesota. And so we have a wide variety of human health messages that are available on our website, including targeted human health sheets for each industry and backyard poultry and wildlife and hunter exposures. We have information on PPE along with videos on how to safely put them on and remove PPE, and all of these are available for distribution. And then I just wanted to end with education and outreach. This is a crucial part of the Zoonotic Diseases Unit's responsibilities. And so since we are nearing the fair season and many are planning visits, including breakfast on the farm, I wanted to highlight some of our efforts with enteric pathogens related to animal contact. So the approach that we take in Minnesota is to strike a balance between the risk and benefits of animal contact and having visitors. So there's a risk of both injury and illness that comes along with animal contact. Animals can be unpredictable, resulting in bite, pin, or kick injuries, and zoonotic diseases are also an inherent risk of animal contact. However, there are benefits to human and animal interactions, such as people having the opportunity to learn about animal agriculture and to understand where their food comes from. They also have the chance to observe animal behavior and experience the human-animal bond. So, in general, which pathogens or germs are we most concerned about? So this chart just shows mainly the pathogens that we see usually with these types of visits. These are pathogens that are commonly found in the digestive tract of food animals, usually our ruminant species, but also poultry and pigs. So E. coli and other, specifically O157, but also other E. coli, Salmonella, Campylobacter, and Cryptosporidium. And the vast majority of them cause diarrhea in people. And so we typically see E. coli in cattle and goats, Cryptosporidium associated with cattle, and Salmonella and Campylobacter in poultry. And so we do see outbreaks that occur nationally every year. So from 2009 to 2023, there were 43 outbreaks of these types of pathogens associated with agritourism venues, 53 associated with fairs, and 25 that occurred associated with school trips. And so how do people get sick from these animals? So again, these bugs or these germs are carried by healthy animals, and they're part of their normal GI flora, and they don't cause illness usually. And it can be really hard. You really can't tell which animals have these germs or are shedding them just by looking at them. And so then how do people get sick? So because these germs are present in the animal feces, these germs can then be spread into the animal's environment or onto the animal's fur and skin. And so then people touch the animals or their environment and then accidentally get these germs into their mouth. And so this is called the fecal-oral transmission route. And so we see transmission through direct contact with animals. So here's just some examples from fair settings. But we also see transmission through indirect animal contact, where people's hands or mouth contact contaminated surfaces, such as railings or animal bedding, and then people can accidentally transfer the germs to their mouths. And so really the main problem that we are dealing with is that many visitors, especially in petting zoos or pumpkin patches or other agritourism venues, don't understand that healthy animals can carry germs that may make them sick or vice versa, understand the risk that people could potentially pose to animals as well. And so this lack of understanding of these inherent risks prevents the visitors from taking action to reduce risks, such as washing their hands, making sure that they're not eating food in animal areas and things like that. So our goal is to minimize a risk by using best practices, but recognizing that the risk will never be zero. And so one of our main outreach areas is targeting those folks that are participating in agritourism. And so we offer workshops and online classes for people who operate agritourism venues such as petting zoos or pumpkin patches or fairs. But we also work with people who have individual visits, such as a breakfast on the farm type of situation. And we also work with 4-H to develop resources that are geared towards members and owners. And so through all of these partnerships, we've provided multiple resources that are available both on our website and also on the University of Minnesota's Extension website as well. And so our goal is to teach about zoonotic diseases, provide resources on how to minimize the risks of transmission. And then we also are available to come and do site visit evaluations that any venue can request. We're not a regulatory agency, so this is not punitive. Really what our goal is to assess the operation and then make recommendations following national best practices and also our experience in investigating outbreak situations to provide practical examples to help improve safety. And so with that, we absolutely love talking about what we do, so please don't hesitate to reach out to us with any questions that you may have. And with that, I'm happy to pause and see if there are any questions now.
Thank you, Dr. Holzbauer. We'll give people a few seconds here to enter any questions they may have. And while they're doing that, one question that I would have is you did a great job covering the human health aspect. If consumers were concerned about their food safety and these animal diseases, where should they go to learn more about their food safety?
For food safety, I think you can go to multiple places. So we actually, our unit here at the health department focuses on direct animal contact. We also have an entire unit that does foodborne investigations and also work very closely with the Department of Agriculture and FDA and USDA. But also I think our Department of Agriculture is absolutely wonderful. They have really great resources and university extension as well at the University of Minnesota are just amazing resources.
Great, thank you. Also, if Farm Bureau members in their own communities want to help get involved in this topic or their issue, is there anything that they can do at the local level to help?
Well, so I covered kind of a broad array of different diseases that we investigate or are responsible for. But I think, you know, if you're interested, please don't hesitate to reach out to us. We are a resource to the public, and you know, we're happy to look at individual situations. If you have concerns about you know, either people being ill and you have a concern that it's related to animal contact, or vice versa, if you're concerned about animals being ill that you think are related to human contact. And if we don't have the answer, we're happy to help put you in touch with people who may have the right answers. Again, we work really closely with our animal health partners and also our, you know, the veterinary clinic, the veterinary school at the University of Minnesota, our veterinary diagnostic lab, and also University Extension. There's really great resources that are out there.
All right, We don't see any other questions that have come in yet, but to those watching, you can always reach out to Dr. Holzbauer with the information on the screen here, or reach out to your local Farm Bureau to help with anything or connect you with the right resources as well. So thank you again for joining us today. The full recording of this presentation will be available on our website and on Facebook shortly following this recording. And we want to make sure you mark your calendars for our next Harvesting Solutions episode, which will be on July 21st at 2 p.m., where we'll be talking about infrastructure and covering rural roads and bridges. So thank you for joining us and have a great week.